No, it's not filming. Hang on.
Yep.
Oh, it's filming. We'll cut that.
Hi, my name's Shakti. I'm a second year medical student. Is it alright if I ask you some questions today?
Yeah, of course.
Could I just get your name and date of birth, please?
Yeah, it's Carl Stewart, and it's 02/02/1984.
Could I just ask how old that makes you?
Yeah, it makes me 28.
Alright, thank you. And is it alright if I call you Carl?
Yeah.
Alright, so what brought you in today?
I was stuck in the toilet for about an hour this morning.
Alright, could you tell me a bit more about that?
Yeah, so I just feel awful. So for the last 2 days, I've gone to the toilet about 5-6 times a day, at least. Normally I only have to go twice.
Alright, you said for the past 2 days.
Yeah.
So could you tell me if there's anything in particular you think started this?
What kind of things do you mean?
So at the beginning of the 2 days, did you eat anything or?
I did eat, now that you ask, I did eat, well, the day before it all started, because normally I eat very healthily, but I was quite busy, and I did eat a kebab from a food truck that I've never tried before or heard of, and it did taste a bit funny.
Alright. And so you've been going to the toilet a lot more frequently now for the past 2 days?
Yeah, that's right.
Okay, so could I just ask, so when you go to the toilet, what are you experiencing?
So, well, my stomach definitely hurts, and it's been a bit bigger, kind of bloated. It's been bloated, and my poo's really runny. Sorry, it's a bit embarrassing. But yeah, it's really runny, and it comes out kind of watery. Yeah, mainly that and the stomach pain.
Yeah, thanks for telling me. So you said your stomach hurts. Could you tell me like exactly where, if you could point?
Just kind of all over it, sort of rumbly. It hurts mainly when I need to go to the toilet.
Okay, and so like if you had to rate your pain from a scale of 1 to 10, would you?
Probably about 4 or 5.
4 or 5. So would you say you can still do your daily activities?
Yeah, I can, but I need to rush to the toilet.
Okay.
Yeah.
Alright, and it hurts more when you have to go to the toilet.
Yeah.
So is there anything that makes it better?
When I've been.
Okay,
Yeah.
so after that, it's less painful. And is there anything that makes it worse?
Not really. I guess if I try hold it in.
Okay. And so has it been getting worse over the past 2 days?
I don't think it's been any different.
Okay. And so other than the stomach pain, the bloating, and the diarrhea, would you say there's anything else happening to you?
What kind of things do you mean?
Perhaps are you just feeling generally unwell? Do you have any fever?
I do have a fever now that you mention it.
Okay.
I have actually, been feeling a bit warm.
Okay, and how long's that been for?
Probably same time. Yeah.
Okay. And have you taken any medication to try?
I have tried ibuprofen. That has made me feel a little bit better.
Alright. And could I just clarify, so when you have your diarrhea, it's like very watery, and is there any like blood or
There's no blood, no.
anything else of concern?
I don't think so.
Alright, thank you. So could I just ask some like general questions about your lifestyle?
Of course, yeah.
So how often would you say you exercise?
I go to the gym every day.
Alright. And do you smoke?
No, I don't smoke.
Okay, have you ever smoked before?
Never.
Okay. And do you drink?
Yeah, I do drink quite a bit. Yeah, it's just when I do go out with my mates on the weekend, I do drink quite a lot. Yeah.
How much would you say you drink when you do?
Well, quite a lot.
Okay.
Have a couple of shots, maybe a few beers.
Alright.
Yeah. Just until I pass out, to be honest.
And do you work now?
I do, yeah. I'm a software engineer.
Alright, and how's that been going?
It's very busy, but I love it.
Okay, so it's been going good.
Yeah.
And how's your home life?
Yeah, it's good. I live with my girlfriend. She's got a busy job as well, but yeah, we're happy.
Okay. Do you have any pets?
No, I don't have any pets.
Alright. And so what's the main thing you want from this?
To be honest, I would like an X-ray.
Okay.
Yeah.
Why, is there any specific reason?
I have psoriasis.
Okay.
So I've been doing a bit of Googling, and I've seen if you have psoriasis, you can get something called IBD, IDB, IBD.
Okay, IBD.
Yeah, and yeah, I just don't want to have another condition, so I like an X-ray to see if I have that.
Alright, so how long have you had the psoriasis?
Since I was 20, so 8 years now.
Okay.
It's quite mild, but obviously I just don't want another condition.
Alright,
Yeah.
I see. And so do you have any other medical conditions?
No, nothing else.
Okay, and are you on any medication for your psoriasis?
I just take I just use a cream when I need to. It's really mild.
Alright, so you mainly want an X-ray to make sure it's not IBD.
Mm-hmm.
And is there anything else you're worried about?
No, nothing else.
Alright.
We can move on to the questions if you'd like.
Yes.
Do you have anything else to ask the patient before we move on?
That's it.
Okay, fine. So would you like to summarise the case for me, please?
Okay, so the patient is a 28-year-old male presenting with watery diarrhea, bloating, and abdominal pain. Has a past medical history of psoriasis, is on medication for psoriasis, also has a fever, and no other relevant past medical history.
Right. And what are your differential diagnoses for this patient?
So it'd be IBD or lactose intolerance.
Okay. That's the end of your station. Thank you very much.